everybody, and welcome to Central Valley Today. Thanks so much for tuning in. We're so super excited because it is Friday. We're ready for the weekend. We've got a lot of great things coming up in today's show, so you don't want to miss it. We're going to be talking to Dr. Wajda in just a second, and we've also got a fashion show for you later on today, and just so many great things. So stick around because Central Valley Today starts right now. All right, we begin this morning by talking about dementia, and it strikes thousands of people every year. It is the loss of brain function, which occurs as a result of various diseases. Although dementia can affect thinking, language, judgment, and behavior, it always affects memory. So, can it be treated? Dr. Bradley Wajda with Esano Incorporated is here with the answers. So welcome back to the show, Dr. Wajda. It's good to see you.
Good to see you.
Is dementia irreversible? And how many people are getting it? I mean, I mentioned thousands, but that's kind of a vague figure there.
Well, and it's a difficult figure because you don't know the causes. Dementia just means that, as you mentioned, memory's always impaired, and then there are other higher order functions. It can be again, as you mentioned, language, motor skills, can also be the ability to think abstractly, your judgment. So when you're looking at things that can do that, there are a lot of medical conditions that create symptoms of dementia that are reversible. Then there are other things that, and most people, when they hear the word dementia, they think Alzheimer's. And that's irreversible. There's also terms involved with dementia that include whether it's static or progressive. Static meaning that, for example, if you have a stroke and it damages part of your brain, you can have symptoms of dementia, but it's not going to continue to get worse because it's still that same area of the brain that was damaged.
Okay, so there are several causes of dementia,
True.
Including brain tumors, and you're looking at them on your screen right now. Chronic infections, you mentioned strokes. Medications. How does that? What medications should we be staying away from? Certain medications?
Well, there's so many medications. When you look in the list of side effects, you'll see that it can cause confusion, memory impairment, and there are people. Oftentimes, I've been called to consultations in nursing care facilities, and look at the medications, and we straighten out the medication regimen, and that person thinks a lot clearer, and they no longer meet the criteria for dementia.
No kidding.
Depression's an interesting one because we actually call that pseudo-dementia. In other words, the individual's so depressed that they just don't put out the effort to think. I mean, they're so internally distracted with their despair, they're not concentrating. They do experience memory difficulties. I mean, depression does affect neurochemistry.
Now, one of the causes also that we saw on the list was vitamin deficiency. Are there certain vitamins that we need to be taking in order to prevent this?
Well, top of the list is in pretty much every psychiatrist or neurologist is going to check, for example, vitamin B, B12, folate. Those are big players when it comes to people who present with signs and symptoms consistent with dementia. Even alcoholics will often present with signs and symptoms of dementia because they're nutritionally deficient in those vitamins.
At what age then should we start looking for these symptoms of dementia? When does it usually occur?
It's not, I mean, they have what they call pre-senile dementia, which by definition is before the age of 65. I never thought of 65 as being senile, but it's certainly less common under the age of 60 when we're talking about Alzheimer's. Now, if it's any of these other conditions, like I said, things such as medication or stroke, there are a lot of risk factors involved in that. But if we wanted to focus just on Alzheimer's, approximately, well, less than 1% of people are affected by that by the age of 65, but then the numbers start going up quite dramatically.
But there are certain symptoms that we should be looking for, including confused motor skills. That's the first one on the list.
Always memory impairment.
Okay.
Always memory impairment, and then as as we look at the list of possible things following that, you can have, again, the problems with object recognition, problems with calculation, abstract thinking. You'll get lost in familiar places. You'll have trouble even balancing your checkbook, learning new information. There can be personality changes. One common thing that I see is that people often want to jump to a conclusion. If they're having a memory problem, they just automatically think, especially if there's a family history, that it's Alzheimer's. And sometimes that will make them put off addressing it because they're afraid of what that ultimate diagnosis could be. There was a talk show host on the radio here locally that sort of jumped to that conclusion with a family member talking about it on the radio, when I thought that's rather tragic because they're experiencing this distress when there could be a variety of other causes.
Well, it's important to get yourself checked out, but it's also important to support the cause of Alzheimer's, and there's an Alzheimer's walk happening, which you are very passionate about.
Yes.
Yes. So can you give us the details on that?
Well, it's going to be tomorrow, and registration begins at 8 a.m. It's at Copper River Ranch Park. The reason that I wanted to talk about dementia today and the medical side of it was because I saw those folks on Central Valley Today earlier this week, and I thought this would be great to remind people not only of the walk, but that there is so much out there with regard to depression, and we should not rush to judgment, and we should be giving generously because there are great strides being made, including you know, the early detection. They can check cerebrospinal fluid for the protein that is seen in Alzheimer's, certain protein deposits that result from cell death, and they can predict with 80% accuracy.
Wow, so much can be done, and all we need to do is support things like the walk that's happening this weekend. So, Dr. Wajda, thank you for bringing that to our attention and for giving us even more details about the treatments and everything that's possible out there. Thanks again, and we will see you next week.
Yes.
All right, thanks again. Don't go anywhere. Central Valley Today, we'll be right back.